Warning: this content may be upsetting or disturbing to some audiences. Under the skin flap, there were 3 sizable maggots. Medical professionals: when did you have to tell a patient, "I've seen it all before," to comfort them? Years ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts since he had no idea how he would put this child back together. He also told me I'd use the films as a teaching aid. He's one of my heroes. A dog bit my little sister in the face, ripping through her mouth and cheek. It was at a soccer game. She crawled on top of a big dog called a borzoi, which startled it. It rolled over and bit her in the face. This was the late 80s, smaller town. There were no pediatric surgeons available, no plastic surgeons. She was in the ER with her face ripped open. Anyways, our general pediatrician, who is now my kid's pediatrician, 30 years later, who had only graduated maybe 10 years prior, sewed her face back together. It was 30 stitches on the inside of her mouth, and 30 or so on the outside. She had a massive scar down the whole side of her face. Anyway, fast forward 15 years. She grew normally, her face is fine, her smile is fine, no long-term damage. Apparently, a face is full of nerves and muscles, and that's why only plastic surgeons work on faces. Particularly with children, having nerve and muscle damage can make their face grow crooked as they age. It is a highly specialized field. But in this case, there was nobody else, just a general pediatrician, and he managed to save her face, with no long-term nerve or muscle damage, or even scarring now that she's an adult. We found out 25 years later from our pediatrician's wife, that he spent an hour or so crunching his old med school books in the seat of his Plymouth Reliant in the hospital parking lot, studying facial anatomy, nerves and cheek structure, etc. He walked into the hospital and performed a multiple-hour surgery on her face, sewed it back together, perfectly. You would think a plastic surgeon did it. His wife told us he came home that night, just flopped down on the couch, and sat there, amazed that he'd done it. Proud, but cautious. A new general pediatrician sews a toddler's face back together. And it worked. Now, you would never know it happened. And he has never, ever, done another surgery like that again. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious and alert to what was going on. His jaw looked like Predator. I had the family freaking out, of course. Had to tell them we see worse often. Which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. I work in gynecology and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her vaginal area was completely red and swollen. He then so gently inserted the speculum to get a look, and immediate white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with a prescription medicine. That day I learned if you smile while humming, it helps in suppressing your gag reflex. I was the patient actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery, was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg, and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love, and eventually trusted her enough to let her read my medical records. I had never read them, because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one hell of a poker face. A lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, Gale abnormalities. CT brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. 4th-year med student here. On my ER rotation a couple months back, I walked into the emergency department and was immediately asked to help a nurse and resident put a catheter in a patient. Now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room, and I'm immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient has to be pushing 400 pounds and has the worst soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his penis. The nurse had a speculum, tool options used to look inside vaginas, inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pee and poop. I still don't know how he let his scrotum and penis swell that much. ER tech here. A few months ago we had an elderly gentleman come in presenting with shortness of breath. As I was getting him into the gown and into hospital socks, I noticed very old, yellowing bandaging around his foot. I inquired to its purpose and he told me it was a large wound on the back of his heel that wasn't getting better. I asked him if I could unwrap it to inspect it and possibly rewrap it. Basic wound care is one of my duties, and it was a literal hole in his heel about 4 centimeters in diameter, skin necrotic around the edges, with a large flap of skin covering the middle. I wasn't terribly shocked. Until I swore I saw the skin flap writhe a little bit. I got the patient's consent to look under the skin flap and sweet galactic Jesus, there were 3 sizable maggots just chilling. I've read about it before but I have never seen it in person. My brain went, what in the solar hell, and despite my attempt at a poker face, the gentleman read my reaction and asked, is it that bad? I was straight up with him and told him that the wound had maggots and needed immediate treatment, and the poor guy started apologizing for bringing something disgusting. I told him, I see this more often than you think. Maggots are actually great at cleaning out dead tissue and are used as treatment sometimes. He seemed relieved by that, but it was definitely my first time ever seeing a maggot-infected wound. I'm an RN who specializes in wound care. We see a lot of crazy things in my clinic. A common occurrence is a pilonidal cyst, which is an abnormal growth in eugluteal cleft, aka butt crack, that contains hair. It usually happens with younger people, say 13 to 20-year-olds, and is obviously very embarrassing to the patient. When we get them, they've already had the surgery to open and extract the cyst, so there's a few holes left that we have to heal. One poor soul that came in had the worst post-surgical hole I've ever seen. It was so big, it extended from the top of her crack to the top of her anus, then are on either side about 12 centimeters. It was like the surgeon carved out most of her butt. The patient was devastated, and I tried to comfort her by telling her she's not the worst I've ever seen. Poor girl. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. A motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid and somehow somersaulted, landing on his butt sitting up. He slid across intersection mostly on his butt, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his butt. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. I worked as a tech in the ER for a while and had a woman in her 40s present with burning and pain down below, discharge and a bad smell. I got the cart set up for a vaginal exam, got her vitals, blood and urine. She couldn't pee because of the pain, she said, all the basic jazz you do when someone comes into the ER. I process my samples and let the nurse know everything is done, and she goes to talk to the woman and it essentially goes as this: no, she hasn't had any trauma, no assault, no she doesn't know what's going on, but it started about 3 weeks prior. Long story short, we get the doctor as the woman refused to let the nurse take a look, and we are all in the room when the doctor turns the light on under the drape and immediately asks if she's been using any medication vaginally. There's clearly a lot of irritation and swelling as well as a very strong odor, and she hadn't even inserted the spec yet. The woman says no, nothing. At this point the nurse goes to get some saline and I'm left to hand off tools and handle any swabs. The first swab handed to me was literally tinged a pale green, clearly infection. I'm capping it and the woman smells the odor slowly filling the room finally and starts apologizing. I had to say while trying not to gag, no need to apologize, I've seen much crazier things, just relax and we will get you all fixed up. Well, the nurse comes back with saline and the doctor starts essentially flushing this woman's vagina, trying to clear out all this discharge and infection so she can see what's going on. All of the sudden she stops and asks if she's sure she hasn't been putting anything in her vagina to treat any medical condition, even something not given by a doctor. And that's when we found out for about a month, this woman had been douching with a bleach and water mix to try and cure a yeast infection, because she read that in hospitals we wash down with diluted bleach to kill germs and thought it would work. She was riddled with chemical burns and infection and was immediately transported to a bigger hospital. So yeah, that happened. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door so I expected it to be bad, but when I went to pick up the leg by his heel there was just nothing there. His foot just evaporated into pus and maggots and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened, he just sighed and asked me to pick up his foot. What foot, buddy? Put it back on. He said it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic, that's me by the way, got grossed out. Had a patient who needed a lower GI study to find and fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, I kinda wanna try and poop. He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. I used to do psychiatric evaluations in an emergency room setting. One time, I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions, and she stops me and says, "Excuse me, but I need to pass some gas." I let her know that this is a medical setting and that is a completely normal body function and not to be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding fart I have ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving, but then the smell hit me. It was bad enough that I started to gag and had to excuse myself from the room. When I came back I politely asked if she needed a nurse for anything in case she needed to be cleaned up after that, but she declined. Obviously I've witnessed people farting before, but I've never heard or smelled anything like that before. That was something else. Thanks for listening to Radio TTS. Hit the subscribe button and activate the notification bell for more videos. Click the right box for the second part of this video. And share your own hospital stories in the comments below, especially the gross ones.